Blurred vision, a common symptom that many of us experience occasionally, can be more than just a sign of eye strain. It is a characteristic that can have deep causes, including neurological and inflammatory issues. We often associate vision problems with aging or excessive use of electronic devices, but there is growing evidence that neuroinflammation, an inflammation of nerve tissue in the brain, can destroy a crucial role. Blurred vision is a problem that many face, but few fully understand. We often think that it is just a consequence of eye strain or aging. However, its causes can be diverse and include everything from refractive problems, such as myopia and hyperopia, to more serious eye diseases such as cataracts and glaucoma. Vision problems can arise due to a temporary inability to focus as a result of prolonged use of screens or intense reading. Furthermore, factors such as dehydration, medication use, and even atmospheric lighting can contribute to this visual discomfort. It's important to remember that blurred vision is not just an isolated problem, but can be indicative of more serious underlying conditions. An often overlooked cause of blurred vision is dry eye syndrome, which occurs when the eyes do not produce enough tears or the quality of the tears is suppressed. This can result in a dry, inflamed ocular surface, causing discomfort and blurred vision. Environmental factors such as exposure to wind, air conditioning, and long periods of time in front of screens can exacerbate this condition. Additionally, some autoimmune diseases, such as Sjogren's syndrome, can affect tear production, leading to chronic eye safety. Visual problems can also be associated with systemic conditions. Diabetes, for example, can cause fluctuations in blood sugar levels that affect vision. Diabetic retinopathy, a complication of diabetes, occurs when blood vessels in the retina become damaged, causing blurred vision or vision loss. Hypertension and cardiovascular disease can also impact eye health, as inadequate blood flow can damage the delicate tissues of the eyes. In addition to physical factors, psychological and emotional aspects can also influence vision. Stress and anxiety can cause tension in the eye muscles, resulting in difficulty concentrating and blurred vision. During periods of intense stress, the body releases hormones that can affect eye function. Therefore, stress management techniques such as meditation and breathing exercises can be beneficial not only for mental health, but also for eye health. In short, blurred vision is a multifaceted problem with several potential causes. From refractive issues and ocular conditions to systemic illnesses and psychological factors, it is essential to approach eye health holistically. Regular ophthalmologist visits, a healthy lifestyle, and stress management techniques are essential to maintaining clear vision and preventing long-term complications. Neuroinflammation, or inflammation of the brain's nervous tissue, is a growing area of study that has revealed surprising connections to eye health. The eyes are, in many ways, an extension of the brain. They share a complex network of nerve connections and blood vessels that allow rapid and efficient communication between visual stimuli and brain processing. When the brain becomes inflamed, this communication can be disrupted, resulting in visual problems, including blurred vision. This is because inflammation can damage the optic nerves and other critical components of the visual system. Neuroinflammation can be caused by a number of factors, including infections, traumatic brain injury, autoimmune diseases, and even chronic stress. When brain tissue becomes inflamed, the body responds by releasing inflammatory cytokines, which can cross the blood-brain barrier and affect eye function. This inflammatory process can lead to a series of visual symptoms, such as blurred vision, sensitivity to light, and difficulty focusing on nearby objects. In addition to direct effects on vision, neuroinflammation can impact cognitive function, resulting in memory lapses, difficulty concentrating, and feelings of mental dullness. These symptoms worsen visual problems, creating a vicious cycle where blurred vision can contribute to mental confusion, which in turn further hinders the ability to focus visually. Therefore, it is essential to treat neuroinflammation comprehensively, addressing both visual and cognitive symptoms.
Early identification of neuroinflammation is crucial to prevent permanent damage to vision and brain function. Advanced imaging techniques such as functional magnetic resonance imaging, fMRI, can be used to detect inflammation in brain tissue. Additionally, blood tests for specific inflammatory markers can help diagnose the condition.
Once indicated, treatment of neuroinflammation may include the use of anti-inflammatory medications, dietary and lifestyle changes, and therapies designed to reduce stress and improve brain function. Therefore, blurred vision should not be ignored or treated as just an isolated eye problem. Brain inflammation may be a significant fundamental factor that requires an integrated approach to diagnosis and treatment. Consulting a specialist in neurology and ophthalmology can provide a more comprehensive view of the problem and help develop an effective treatment plan. Neuroinflammation is a complex condition that can manifest itself in many ways. In addition to blurred vision, other symptoms include mental fatigue, memory difficulties, and mood changes. These symptoms may be subtle at first, but tend to worsen over time if not treated properly. Inflammation in the brain can be caused by infections such as meningitis or encephalitis, but it can also result from autoimmune conditions such as multiple sclerosis. In these cases, the immune system mistakenly attacks brain tissue, causing inflammation and damage. Another common symptom of neuroinflammation is headache, which can range from mild to severe. Unlike migraines, headaches caused by brain inflammation are usually constant and may be accompanied by a stiff neck, fever, and sensitivity to light. In some cases, neuroinflammation can lead to seizures, especially if it is caused by an infection or traumatic injury. Seizures result from abnormal electrical activity in the brain, which can be triggered by inflammation of nervous tissue. Neuroinflammation can also affect mood and behavior. Patients often feel depressed, anxious, or irritable. These mood swings can be particularly difficult to deal with, as they affect quality of life and personal relationships. Brain concentration can interfere with the production and regulation of neurotransmitters, chemical substances that transmit signals between neurons, contributing to these mood changes. Treating neuroinflammation can therefore help stabilize mood and improve overall mental health. Another critical aspect of neuroinflammation is its impact on cognitive function. Patients experience difficulties with short-term memory, find it difficult to concentrate on tasks, and feel constant brain fog. This can hinder performance at work or studies, making it difficult to carry out tasks that were previously simple. Neuroinflammation can impair brain plasticity, the brain's ability to form new neural networks, which is essential for learning and memory. Finally, neuroinflammation can have systemic effects, impacting other organs and systems in the body. For example, brain inflammation can be linked to intestinal inflammation, strengthening a connection between the brain and the gut. This brain-gut axis is an emerging field of study that explores how gut health can influence mental health and vice versa. Treating inflammation in both systems can be essential to improving overall health and preventing long-term complications. In addition to the more well-known symptoms such as blurred vision and headaches, neuroinflammation can cause a range of other problems that impact quality of life. One of the frequently reported symptoms is ringing in the ears, or tinnitus. This persistent sound may be a sign that inflammation is affecting the auditory nerve pathways.
Although tinnitus can be caused by several other conditions, its presence along with other neurological symptoms may indicate underlying inflammation in the brain. This can lead to a constant feeling of irritation and discomfort, impairing sleep and concentration.
Another common symptom of neuroinflammation is chronic fatigue. Unlike common fatigue, which can be relieved with rest, chronic fatigue persists even after prolonged sleep. This constant exhaustion can make it difficult to carry out daily tasks and significantly reduce quality of life.
Chronic fatigue is often associated with a feeling of brain fog, where the individual finds it difficult to think clearly and maintain concentration. This can be particularly frustrating and debilitating, affecting both personal and professional lives.
Sleep problems are another important aspect of neuroinflammation. Inflammation in the brain can interfere with sleep patterns, resulting in insomnia, interrupted sleep, or unrefreshing sleep. Poor quality sleep can exacerbate other symptoms of neuroinflammation, creating a vicious cycle of tiredness and deteriorating mental and physical health. Insomnia, in particular, can increase stress and anxiety levels, which in turn can worsen brain inflammation. Therefore, it is crucial to address sleep issues when treating neuroinflammation. Neuroinflammation can also manifest itself through changes in mood and behavior. Many patients report feeling more irritable, anxious, or depressed. These mood changes can be sudden and without an apparent cause, making social interaction and maintaining relationships difficult. The influence can affect the production and regulation of neurotransmitters, chemicals responsible for communication between neurons, contributing to these symptoms. Treating neuroinflammation can help stabilize mood and improve emotional well-being. Finally, neuroinflammation can impact cognitive function, resulting in memory problems and difficulty concentrating. The ability to learn new information and perform tasks that disable quick thinking can be significantly impaired. These cognitive symptoms are particularly concerning because they can interfere with performance at work and studies. In more severe cases, neuroinflammation can lead to neurodegenerative conditions such as Alzheimer's and Parkinson's, where brain function is progressively compromised. Therefore, it is essential to address neuroinflammation early to prevent permanent damage. Neuroinflammation can have a devastating impact on daily life, affecting not only physical health but also mental and emotional well-being. Blurred vision, for example, can make simple activities like reading or using electronic devices extremely challenging. This can lead to decreased productivity at work or school and interfere with leisure activities. The constant need to adjust visual focus can cause eye fatigue and headaches, further aggravating symptoms of neuroinflammation. Another significant impact of neuroinflammation on daily life is the difficulty of maintaining a healthy sleep routine. Sleep problems such as insomnia or disrupted sleep can result in chronic tiredness, affecting energy and mood throughout the day. Lack of restful sleep can reduce the body's ability to fight inflammation, creating a vicious cycle where neuroinflammation perpetuates sleep problems, which in turn worsen inflammation. This can lead to a constant feeling of exhaustion, impairing the ability to carry out everyday tasks. The changes in mood and behavior associated with neuroinflammation can also have a profound impact on interpersonal relationships. Irritability, anxiety, and depression can make it difficult to interact socially and maintain safe relationships. These mood changes can be difficult for both the affected individual and their family and friends to understand, creating tension and conflict. Psychological and emotional support is crucial to help deal with these challenges and improve quality of life. In addition to the mental and emotional impacts, neuroinflammation can affect cognitive function, resulting in problems with memory and concentration. This can make it difficult to perform tasks that disable quick thinking and problem-solving skills, affecting performance at work or studies. The feeling of brain fog can be particularly frustrating, as the individual may feel that they are not operating at their full potential. Strategies to improve cognitive function, such as mental exercises and a diet rich in essential nutrients, may be beneficial. Ultimately, neuroinflammation can lead to increased susceptibility to chronic diseases and neurodegenerative conditions. Prolonged inflammation can damage brain tissue, contributing to the development of diseases such as Alzheimer's and Parkinson's. These conditions are specific to progressive changes in cognitive and motor functions, resulting in a significant loss of independence and quality of life. Therefore, it is essential to address neuroinflammation comprehensively and early. Incorporating lifestyle changes, medical treatments, and psychological support to prevent long-term complications. Neuroinflammation plays a crucial role in brain and eye health, contributing to symptoms such as blurred vision, chronic fatigue, mood swings, and cognitive problems. Understanding the connection between the brain and eyes is essential to addressing these problems effectively. Holistic approaches that include an antioxidant-rich diet, regular exercise, stress management techniques, and appropriate supplementation can help reduce inflammation and improve overall health. Early and integrated interventions are essential to prevent serious complications, such as neurodegenerative diseases. Therefore, taking care of brain health is essential to maintain a clear vision and a good quality of life.